Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne, on scars, pigmentation, and I do a lot with facial balancing. This patient came on our live the other night, and I promise I'll show his results. So I think he may end up coming back on tonight. I said I'll try to do it today. Let's see if he comes on. But either way, this was after a single session for this particular patient. And I'm essentially just 1 year later. And I spoke about his case a little while ago. He came on, was showcasing that he was super happy, super thrilled with everything. And I want to show just a little bit more. People were asking if they could see some more of that, the scarring. It's really nice, in fact, after a single session, kind of what to expect. There's still some scarring, of course. We still see those boxcar scars, but it's significantly lifted up here. And it's going to continue to improve. When he came in this day, I ended up doing just a little bit of Bellafill. He just takes it really slow just due to his budget. But, I'd expect as we keep on chipping away at this, keep on working on it, we're going to continue to get better and better results. I did some, I believe, some TCA Cross that day as well. So TCA Cross and some Bellafill the day he came in. But, just after a single session, really nice, significant improvement over here. Somebody who comes on over here every once in a while too. So you can ask him if he does happen to show up. Let's see. But, it's nice. It's nice to be able to have this kind of effect because this is a patient who flies in all the way from Virginia, somebody who really wanted to make sure that he was going to get his money's worth. He had done multiple treatments before in the past, spent thousands of dollars over in Virginia on microneedling and a Fraxel laser as well, and didn't really get much improvement at all. So it was like, after a single session with me, got the effect that he wanted, then came back just to try to get a little bit more filler with some Bellafill and some more TCA Cross. And, I wish I could have done some more things, but he says he just has to take it slow for himself right now. He can't take off time of work and just also just the budget. So we'll go slow. We'll keep on chipping away at it slowly. And it's really nice. It's really nice. I showed, you guys may recognize this patient from before because he came on and he was like, talking about how impressed he was, and then was supposed to show it again, so I wanted to showcase this for everybody else then too. Let's see here. Butterfly saying, I have boxcar scars and ice pick scars. I'm trying TCA Cross. Good option. That's a great option for both of those. It's just a matter really for the boxcar scars of being really careful with the depth of the scars. You got to make sure that if they're relatively superficial, you don't use too high of a concentration. I mean, that still goes for the ice pick scars as well, but you gotta be really careful with that though, especially with those boxcar scars. They could get a little bit wider kind of fast. Melly saying, when he goes slow, does he pay the same amount as someone who did a lot at once? Well, he did do the combination session initially, and then, if he was to do future laser sessions, that would be 55% off. But things like volume, that's just, he will have to just pay that, as it is. The thing with him is, though, I do want him to do a lot more volume for him. It would be nice if I could put a little bit more in there. It would be nice if I could do some more treatments for him. But, that aspect, he can't afford the additional Bellafill, which is okay. Like I said, you're never going to hear from me that like you just have to do this many amount of filler. You just have to do this much of like Sculptra, this much of Bellafill. Otherwise, you're just never going to see improvements because I know that like everybody's budget's different. And I don't want to like pressure you and just like, this is what I would recommend. And some people, I showed you the case yesterday where I didn't even do any Bellafill on the patient. We ended up lifting up the scar tissue really well without that. And I told them that it's going to be fine. We'll take a look and see after I break it up if we need to do anything. And it's, what I see though, like I do so much of this, I know that like there's going to be fat loss. There's going to be real fat loss that we have to put something in there. And I'll tell you, let's start working on it and let's start chipping away at it. My patient today, it's like I did a couple of the Bellafills, and I knew though that I don't want to make it too puffy, too overdone, and we're just going to go slowly. So we'll just do 2 at this time. She has a lot of volume loss in certain areas, and so we'll do another one in 3 to 6 months from now, and when that swelling goes down. I like doing it that way. I like it just so it integrates really well with your tissue. You're smiling naturally the way you normally would. And then it's like we can now put it in some like nice discrete spots like that. That's the way I like doing it. What can I do to help my scars from getting bigger? Control oil. That's really the biggest thing, actually. Just make sure you control oil production. And otherwise, there's probably not going to be too many other big things. I see you on, by the way. I don't know if you're okay with me shouting you out, but thanks for coming on again. I told you I was going to show your case again. Jay Eric is saying, hey, what is your opinion about microdermabrasion, please? Do you not find it useful for scar treatment? Yeah, microdermabrasion is not going to help much at all for scars. I mean, that's just really a exfoliant, a physical exfoliant that they're rubbing onto the skin. And I'm not in favor of physical exfoliants in general. And when it comes to scar treatments, it's not going to help us. It's just going to irritate the skin. I would not really recommend that even a little bit. But dermabrasion is very different. That's more like a surgical procedure. Very, very few people do it in the world, or at least in this country, I should say. In the world, actually, they do it more often. But it's kind of fallen out of favor because people are using motorized tools and they're causing more hypopigmentation, more complications with it. I do dermabrasion in my practice, but it's something you got to be really careful with for sure. So if you're talking about true microdermabrasion, I definitely would not recommend that for vast majority of scars. Thank you, Masood. Thanks for coming on. So Masood's come on right now, and he's saying, hi, Doc. Hope you're doing well. Thank you for displaying my results again. You are the best. Appreciate you, too. Thank you so much for that. If you could remind me, by the way, how many sessions of other treatments did you do? Because I didn't have it up front of me. I remember I mentioned it last time, and I think you told me like it was like several of the microneedling. Was it 10 or so, something like that? Just if you could remind me about that. I actually kind of wanted to see what that was. Where are my prices? So our prices are on our page. You could go at drqazi.com and you guys should just go look at our prices, a price list over there. Everything's just upfront and clear for you. And vast majority of patients for their scars spend about $5,000 to $7,000. But if there is more volume loss, if there's more things that we have to do, like more excisions, more treatments that we have to do, then it could go up. But future laser sessions, future TCA Cross sessions after that bigger combination session are 55% off. So I knock it out of the park when you do it. And did actually today. I had 3 excellent cases. I know for a fact that they're going to be awesome. Actually, I don't know if the patient's on right now, but like there was really, really tight scars. And, 2 of the patients that I had were like long-standing smokers. And it's like, I've said it over and over, and it's really like, there's a very familiar pattern with smokers. It's actually like, there's like this thickening with the boxcar scars. There's these ice pick scars. It's something interesting to me because my generation, we stopped smoking. And then they got all of you guys. They got all the young guys at like, with this vaping stuff. All this stuff was like, it was marketed to you. And I feel bad that it happened like that. But some people were smoking for like since they're teenagers, with vaping, and everyone was told that it was just like safe and it was just like tasty and all this stuff. It's really unfortunate how they did it. And they openly said it. They said it that way. Masood said that he did 7 skin pens and 3 Morpheus 8s. It didn't help at all. That's a lot. Yeah. So that's a lot there. I appreciate you telling me that. Thank you so much for that, by the way. And by the way, so people ask all the time about Morpheus 8 for scars. In this case, it would have been a real problem actually, because these were mostly rolling scars, boxcar scars. And if they had overheated the skin to melt the fat, essentially what I should say is if they had tried to treat the scars, they potentially could have used high heat and high energy settings with that, and then they could have melted fat. And you really could get the scars looking worse actually that way. So you don't want to do it that way. I've had people literally argue like years ago when it was this all big radiofrequency microneedling. They used to insist that you should use high heat, high energy, otherwise it's not going to work. And they say the same thing for lasers, by the way. They're like, oh, you have to use like a really high settings for that, max settings. And for radiofrequency microneedling, things like Morpheus 8, it really could be catastrophic for some patients. I have a patient, one of my patients, she's an actress, and they did radiofrequency microneedling around the eye area. She has like perfect features, everything, and they melted some fat there. It looks like it to me, at least it looks like it to me over there. And it's like, it's unfortunate because she wasn't aware of that risk. They didn't tell her that could potentially happen to her. And she's, gaunt already. She's got really great, great anatomy. And I don't even know why they would do that. I don't know why they were doing it on her. And she also has, a bit of melasma, which is one of the reasons why I've been treating her. So it was like high heat, high energy with a patient with melasma. And like an actress, and they melted it. It's like, this is like really some of these guys are just grifters out there. Masood's saying you are 100% doc. They just push their packages, unfortunately. And that's what I'm saying. It's, you'll hear it over and over and over again. Patients will come to me. They'll say it on the lives too. They'll say that, I was told that, this sort of radiofrequency microneedling package or this sort of laser package was what I need. And is this what I need to do? They told me that I need, 3 to 6 sessions, or they sold me a package of 3 or something like that. And it's so common, and it's like for these kind of scars, it actually can make it worse. So not only are the fact that they're doing things that sometimes just ineffective, like I would say that, for example, like the microneedling pen is relatively ineffective for these kind of scars, pretty ineffective for those kind of scars. But in general, the pen is probably not going to cause too much of a problem. But radiofrequency microneedling with those kind of scars, if you're trying to treat it directly for the scars, it actually could melt some fat, and you could end up potentially causing it to look worse. So you could make patients look worse. I've had a lot of patients over and over and over again tell me the same thing, that they've tried it and it made their scars look worse. They tried it and it made their scars look worse. So it's like over and over, you hear these stories and you just gotta kind of stop it. Actually, if there's somebody out there that can stop it, I think it's me, because I just showcase this all day long. And I do this all day long. And I think that I could be able to say really clearly and confidently that this is not the case. It's just not going to work, and that way it's like, let me just get my toy, there you go. So yeah, if it did work, I would do it all day long, right? Like clearly I would do it. What percentage improvement does the average achieve? What percentage improvement do you think is this right now? I don't know. Everybody always says, last photo I said, most people said 70%, 70 to 80%. One person was just like 30 to 40%. So I don't know. That's why it's so subjective for everybody. But what do you guys think? What's the percentage improvement for this patient? This is 1 year out for this patient. 1 year single combination session for this patient, actually. And he's on right now, by the way. You can ask him questions. Let's see here. Sean is saying, if I'm from out of town, will one TCA session fix my acne scars? Doubt it. No, not for ice pick scars. But if we do potentially like excisions, or we combine it with some laser, probably we could do it in less sessions. But it's still not going to be a one session. Almost none of these type of things are one session. Although it depends on what you're trying to achieve, what kind of look you're trying to get to. That's what a lot of it matters. A lot of this is really about what level you're trying to get to. There's some people that are trying to get pretty close to perfect. And in a way, that's actually more difficult, more of a challenge than people that had more severe cases and are happy to get to more of like the moderate level, the mild level. That's like a real like happiness for them. But there's people that were like, it's pretty smooth, pretty clear, and like a little bit of scarring, a little bit of texture, and they want to get it really, really close to perfect. It's actually going to probably take more sessions, I should say, less heat, less energy probably with it, but like more sessions to be able to get to kind of what they're trying to achieve. It's not as fast or easy just because of that. And we did use Bellafill for this patient as well, which helped out a lot. So Bellafill is a product that is 80% cow collagen, 20% something called PMMA. We placed that during the procedure. In this case, we could put that in these little areas that have the most deficit there, really to support the scars, to support that volume loss. And then what's nice is that 20% continues to stay there, and then it'll help just generate some more collagen over there. Are the prices on your page for one session? Yeah, we don't do real packages really when it comes to scars or for most of my treatments other than like pigmentation. Pigmentation I found really does take a while. It really does take really about 6 months usually to clear up. CP saying, how crazy will my skin look after, say I fly in and out the same day? Well, it's gonna, you can ask Masood right now. His look crazy. I don't know if he flew out the same day and in and out the same day. It's okay. Like, who cares, right? It's like, whatever. You're not going to see the people in the airport again. You're not going to see the people on the airplane again. Whatever. It's we haven't run into any problems so far with anything like that. But you can always stay like a day or two if you want to. But I would say we have most of our patients from out of state. A lot of patients also from Northern California who fly, and they have no problems with that whatsoever. They actually, fly out the same day or fly out the next morning. It's no big deal. We manage most of this really, like especially with the laser portion of things. Any of these kind of procedures, really we could manage the aftercare remotely. But when it comes to phenol peel, then yes, we do want you locally then for that. But that's a different conversation to have though. What is good for hypertrophic nose scars? Good question. I mean, it's depends. Sometimes what there's these little discrete like circular bubbles, like these spheres that are there, these papular scars. You could try to burn those down with a CO2 laser. It may take a couple times to be able to do, but you really have to have patients use silicone tape there and really have them do it as much as they can. Nighttime is the most critical time, but really as much as they can, it's really important. And for as long as they can, it's going to really help so it doesn't rise again. And then basically one thing I forgot to mention there is that a lot of times through the laser tunnel holes, we'll put a dilute form of steroid there. And that usually could help it prevent it really from getting hypertrophic again. So that could be one option there. JL is saying, is the Noker needle safe for subcision? Good question. I mean, certainly it's not something that you would say is just like safe in everybody's hands. There's certain factors that really I would, when I look at people the way they're doing it, I see sometimes they don't put really any local numbing solution in there, which will have like epinephrine, for example, which is really important actually because when you're using a Noker needle, which has a blade at the end, basically it's a sharp tool that you place underneath the scar tissue and you're breaking up each individual scar with that. What happens sometimes if you don't have enough numbing in there, you could actually cause a hematoma, basically a collection of blood that's there. And that could, cause a potential infection. That's more inflammation over there. It delays the collagen response too. So you definitely want to avoid a hematoma as much as you can. Unfortunately, I've seen people when they do these type of procedures, they're not using that kind of numbing solution in there. And it's, I think it's risky. But there's another thing that I've also seen. It was actually interesting. It was a few years ago. I don't think that they still kind of push it this way, but there was somebody that was actually doing the Noker needle really subdermal, actually. Like it was first intradermal, so basically it was like really, really deep, pretty close to the fat pads as well. And they're using this Noker needle because they're insisting that's the way that like all the scar tissue, they want to get the base of that scar so everything else pops up. And that's really risky in my mind. I mean, there's there's vessels that are over there. There's nerves. There's fat. There's a lot of different complications. There's facial ligaments that you could potentially damage. So that's stuff that I think that hopefully has fallen out of favor. I don't really see too much of that anymore. But at one point, that was actually kind of like a lot of people were doing it that way. There are a lot of people that were kind of pushing also doing these subcisions just dry. Even one patient on here said like, my dermatologist told me to do it dry. Osvaldo, how's it going? Good seeing you on. Actually, I was showing you results actually from you yesterday, actually, by the way. Thank you so much. Osvaldo saying, I'm his patient. I'm happy with my results. I was showing you like a day or two yesterday. I don't remember if it was yesterday or the day before. So thank you so much. Appreciate you. Thank you. Let's see here. HL saying, so Morpheus 8 is not something done now in place of subcision. It said somewhere it is. Well, no, it's definitely not something that should be taken in place of subcision. In fact, in this patient, for example, he did 3 Morpheus 8 sessions and there was so much scar tissue in there. I would just say that, let me just put it this way. I've never had a case where somebody's done a bunch of Morpheus 8 sessions and there wasn't a bunch of tethered bonds after, so there's a lot of tethered bonds still. So it's clearly not breaking that scar tissue up. And if they want to make the claim that it's breaking those tether bonds up, I mean, there's 2 things that really they should do. One, they really should just get ultrasounds to prove that it's the case, that it really is breaking up those tether bonds, and they're never going to be able to do that. And 2, I mean, let's showcase those patients to me and show me, that this is the patient, and we can go in there and see that it's that there's no scar tissue over there. There are some people, very, very few. I will tell you though that every once in a while that I come across that somebody did subcision very, very well. And in certain areas, I'll feel that was done very, very well. Some areas I do see that it wasn't done completely, or whatever reason was, maybe there's new acne there or something else. But I'm pretty aware of who does like high level subcision in America, and even really the world. But it's really clear to me that radiofrequency microneedling and particularly what you mentioned, you were asking about Morpheus 8 is not breaking tether bonds the way that we could do with subcision. It's not giving the same kind of result that you could get for subcision. In fact, it may actually cause more problems. So I would not recommend that at all. Jay is saying, hi, doctor. I'm from India and my doc did CO2 and didn't see even any good crusting and no result. What to do? I have rolling scars. Well, the thing is that with your skin type, they may have held back with the laser. They probably didn't want to overheat your skin, which is understandable. But it sounds like with rolling scars, they really should have done more with subcision, and they probably need to do something with volume replacement. So that probably is why you don't have enough of improvement. And maybe you didn't even need CO2 laser. Can the redness in the picture fade completely? Yeah, I would say that, it's tough to say because he's not next to me, but like if we did lasers, like a little bit of XLV, for example, that would probably fade that a little bit more. It's not something that has to be permanent. There's ways of fixing it. Mostly just topical creams will just improve it over and over with time though. What to use to lighten dark spots, dark marks from acne? I use tretinoin already. Well, why don't you try Eucerin's anti-pigment cream? It's a really good product, actually, just over the counter, Eucerin's anti-pigment cream. But otherwise, Pico laser could work very, very well. Do you treat keloids in the upper back? Tried steroid injections, but they came back more angry. Yeah, I do a lot with keloid injections, so I would be happy to help you, either with lasers, excisions even are possible, and most likely though initially will be conservative with steroid combined with something like 5-FU. Would you suggest subcision for ice pick scars and boxcar scars with no volume loss? I'll have to see really if it's like a high concentration of it, like a high density of it in a certain area, then maybe. But one of my patients today, she had that today. I didn't do it for her because it was kind of scattered around. Were there little pockets of a little bit of areas where it's pulled down a little bit, but it wasn't. I didn't really need to do anything with that. I didn't have to do subcision. I was able to smooth it down with a laser, so not really much to do with that. And we could do some volume though. What would you say the biggest variable in patient success is? Their nutrition and aftercare? Well, the biggest thing I would say, honestly, the biggest thing is smoking. Like smoking history, biggest, number one. And that's why I said so many times over and over and over again, smoking, vaping, smoking. The younger generation is smoking a lot. They're smoking a lot more than my generation. And I just hope that like, if you're not caring about your lungs, you care about it for your skin, because it's really problematic. It's problematic for your scars. It's delaying your collagen response. It's already. You are getting certain kinds of scars, and they're getting basically a little bit. There's thickening around the edges of the scars. It's a lot worse with smokers. Second is obesity. I would say that that's another factor for sure. Third is oil production. And then genetics plays a role, ethnicity, those all play a role. Sun exposure, so it's tough to kind of, for me to rank some of those other ones, but they're all important, really. And diet, nutrition, all big factors, really. So things that are like inflammatory, like dairy products, for example, that's inflammatory. Really cut back on that as much as you can. Just like, I don't even know if you need it. Just consider maybe just taking a multivitamin for your vitamin D. I'm not sure if you really need it, or calcium. Can you do fat transfers for volume loss? Yeah, absolutely, we could. I will show you something next week for fat transfer for volume loss. I don't have it prepared for me right now, but yeah, we absolutely do. Do you recommend taking Accutane to reduce oil production? Yeah, it doesn't have to be like full dose. Sometimes I just do microdosing of Accutane. Sometimes we just do what we could say really just, the cure laser, which is very similar to that. But I really want to control and manage your oil production before we do the scars. Most patients, though, they come to me and it's controlled. It's okay. Here and there, they may have a lesion. That's okay. But it's really more of that oil production that I'm looking at. And it's not just because of like you just put a moisturizer on and things like that. It's clearly oil. You can see like the consequences of oil. You can see that there's like this, the pores are enlarged. And you can see just really where it's like scattered about, like it has this glow to it. It's more oil. Opinions on Adapalene and derma stamping combo for minor pitted scars I can't afford in office. That's not a bad option, honestly. So I like that you said stamping, because stamping is better than rolling. Retinoid, something with stamping, not a bad option. Just the only thing that I'm concerned with though with that is just don't combine it, which I doubt you are. But I have seen some of these products, some of these companies that they use things like pumpkin enzyme or some sort of vitamin C. And I'd be really cautious and hesitant to use those type of things when you're stamping in there. So that's something I'd be really careful with. But otherwise, though, yeah, stamping is better than rolling. So that's kind of why I dismiss a lot of times when like people say derma pen, things like that, or things that roll for scars. But stamping is a different effect. Yes, it's okay. I'm okay with stamping. It's not necessarily useful for the vast majority. Like these kind of scars not going to help enough. But if you just said you have very mild scars, your budget you can't come to my office. Sure. Try stamping, try retinoids, see if that'll help you for your mild scars. Why not? And in fact, if one day you decide to come to me, it's actually great because now potentially it's more superficial. Maybe there's a little bit of collagen response there, and it's awesome. And that's great. I want people to kind of see that they've looked at things, they understand what's out there. And they've looked at their scars, they see the kind of skin that I'm treating, and they can look at this and say that this is like the end of the road. This is the end of the journey for them. But if you're kind of like, you just can't afford it, or it's just pretty mild, then of course, why not? Just try it that way. Just do something like that. Why not? How painful is subcision? There's a lot of numbing in there. So there's a ton of numbing in there. So that's not bad. So Saad is saying, how many sessions has he done for this result? So this patient was one time. He was on here. I don't know if he's still on here, but he was on here actually on your platform right now. So you could ask him, but it was one session actually for him, one combination session for him. Let's see, where was that? I have incredibly oily and red nose. Any suggestions to help manage the oil production? Well, it sounds like it's rosacea, so you likely should be on something that is likely an oral antibiotic, like a low dose of doxycycline, and you may need something topical like metronidazole, potentially. But that's what it sounds like to me. In your experience, is one round of Accutane 6 months enough for oil control? It depends. Yeah, likely. And then you just could go into more like topical retinoids afterwards. But likely, yeah, that's probably good. How often is subcision done? Usually one time for me. Usually, vast majority of patients, one time. And just, if I need to go again, I'll do it again. But it's extremely, extremely rare. And a lot of times that's more with like if they had new acne breakouts, things like that. Extremely rare for me to do it. In the lower part of the face, we may have to do it again just because I don't go using sharper tools as much over there. So very, very rarely do I use that. But also, I don't find that the bonding is that thick usually there, and we usually can just break that up with a cannula, so I don't have to. Why can't we use human collagen? Well, because it's risky. They're used to try, I think in the late 90s, and people were getting reactions to it. There was, and it was a big mess because you couldn't just take it out. So that's why. Same thing with silicone. That's why I don't inject silicone. It's not FDA approved. Not only is it not FDA approved, it's they've actually gone out of their way to say don't do it. They put a letter out to say do not inject silicone in the body. And it's like, pay attention to that. And people are injecting it into people's faces. And I sometimes see the consequence of that too. I have patients that come to me and say that, can you help fix this, the silicone issue? And it's really complex. We have to get, studies, MRI studies, things like that to see what's going on with it. It's very, very complex. It's a complex complication. And it's something that was not FDA approved in the face, in the body at all. Like you're not even supposed to inject it. So, that's why I stick with like a few things. Like Bellafill is like the only FDA approved product for acne scars. And I'm saying it not because like I'm like obsessed with the FDA. I think there's a lot of problems with FDA. But I'm saying that because when they do go out of their way to like go against certain things, I think we do have to pay attention. Like they go against stem cells, they go against things like, at least they did up until now. I don't know what they're going to do now, but they up until now, there was, they were against those things. And they were also saying, don't inject silicone. I'm not sure if I would necessarily trust a lot of stuff right now anyways, but like I didn't trust it before much. And now it's like, I don't know, based on what I'm seeing, I'm not so sure. Can I do subcision on the lower cheek and neck? Lower cheek and neck, yes, yeah. I mean, with me, like I don't use sharp blades down there. Do not do not use a tear liberator down over here. You really could, cause a lot of problems with shifting fat, and so I would not recommend that. And it could cause a real like indentation there, more scarring. So I wouldn't recommend that. Abracadabra saying, I don't know, I can still see scars. You should see scars. That's a realistic result. You should see it. It's one single session. This is a one single combination session 1 year later. So you should see the scars. And it's like, I want people to know. I want everybody to know. I want everybody in the world to know what you should expect if you follow instructions, do everything right. In certain ethnicities, this patient is I believe Afghan origin, if I'm not mistaken. You're on right now, if you're still on, I believe. And, so you can kind of see like just what to particularly expect for a single combination session for this patient. And I personally, when I was going down my own journey, I was just tired of everybody just showcasing results after a week. They were showing like, stuff that was like clearly inflamed, clearly swelling. If I showed like results after a week, guys, I would just be like left and right, just like everyone looks incredible. Like it looks scarless like 1 week later. Like it's so like amazing 1 week, 1 to 2 weeks later. If you do just like hyaluronic acid filler for 6 months, it'll look great. Afghan. So yeah, so this is, Afghan skin and thicker skin. So it's like you can kind of gauge then like, okay, you similar ethnicity, maybe particular kind of scars. And hopefully, you can notice that he doesn't have much oil production to start with. Hopefully, when we're starting our sessions, you don't have much oil production. And then you can kind of see like what can you expect. And it's pretty predictable that way. There's other variables here and there, but I think it's pretty predictable there. Now, Abracadabra saying, that's a great result for a first session. I'm impressed. Thank you so much. Yeah, I guess I should have put in bold single combination session there. I should have said that actually. Single combination session there. Sometimes it was like I was doing it at the last moment there to come on, and I didn't get a chance to put that up there. Are you able to do higher laser settings on Fitzpatrick type 3 skin? Yeah, I could. It's really fun, honestly. Sometimes like Fitzpatrick 1 through 3, we could crank it up a bit for certain things if you have a little bit of downtime, and we could smooth things down a little bit faster. Sometimes, and it's like with other types of skin, sometimes you have to be a little bit more creative with the laser, with the way we're doing other tools, other things like that. But sometimes with Fitz 1 through 3, it's like we could do a little bit more with the laser. Can you mention what's a good combination for deep pitted scars? I guess I'm not sure if you have to determine you have to tell me what kind of scars you're referring to. Are you saying like deep ice pick scars, deep boxcar scars, all different types of things that we would do. Sometimes for ice pick scars, we do TCA Cross. Sometimes we do excisions. For boxcar scars, same things actually, but more also we would do more laser with that. Probably a little bit of filler there as well. Can this be improved more? Yeah, we could continue to improve this. And when he came in this day, we did some more Bellafill, and it'll continue to get better. All right, everybody, I am going to be done for tonight. I have a lot of cool stuff to go tomorrow. A lot of things I'm going to work on tomorrow. So I'll circle back with you guys next week, and we'll help you out with that. And let me answer this one question here. It looks like a patient here. Am I supposed to use a pre-treatment cream every night pre-procedure? Yes, and just use it with a little bit of vanning cream as well, and so you can tolerate that a little.